and subcut. In this video, you will see me administer an intramuscular injection. You'll have 15 minutes to complete the task. You must ensure that you demonstrate safe, effective medicine management as well as safe disposal of sharps. The procedure for subcut is essentially the same as IM. However, look out for the slight differences in the actual administration technique. I'm entering the room, checking for safety as I do so, and doing my hand hygiene before I approach my patient. According to the WHO steps, palm to palm, palm to back, fingers interlace, palm to palm, fingers interlace, fingers interlocked, rotation of the thumb, tips of the fingers, and finally wrists. Hello, good afternoon.
Hello, good afternoon.
My name's Julie, I'm one of the nurses here. May I know your name, please?
Yeah, my name is Helen Craig.
And what would you like to be called?
Helen, please.
Okay. Helen, would you be able to confirm your date of birth for me, please?
Yes, it's 6th of June 1950.
Do you mind if I just have a quick peek at your wristband?
No, please go ahead.
Okay, so I can confirm on here, Helen Craig, 6th of June 1950, and your hospital number is F001001HC. Helen, I see you have a red wristband on here. Do you have any allergies that you're aware of?
Yes, I'm allergic to penicillin.
Oh, so what happens when you take a penicillin, do you know?
Oh, I come up with a rash everywhere, and if I'm not quick, my throat just swells up.
Okay, well, we'll make sure you don't get any penicillin-based medication whilst you're here. It is actually recorded on your notes, so we're already aware of that. Do you have any other allergies that you're aware of?
Not really, but
okay.
Is there anything specific you want?
Anything with dressings or adhesives?
No, I'm fine with them.
Okay, lovely. So Helen, I've come here today because the doctors have prescribed you to have regular injections. Was you aware of that?
Yes.
Okay.
Someone did mention that I will be getting injections.
Okay, so this injection is a intramuscular injection, which means that it needs to go into a muscle area, so possibly the top of your arm or the top of your thigh. Do you have a preference to which area you would like?
Yeah, I'll prefer it in the top of the arm.
Okay, so this is the first injection you'll be having, is that right?
A very long time ago I had, but yeah.
Okay, so you haven't had this one recently. So this one, the injection we're giving you is hydroxycobalamin, which is a vitamin supplement to help with your anemia, to boost your iron levels.
Oh, that is good.
Okay, we'll soon have you running around the ward and feeling better. Okay, so Helen, I need to go and get my equipment ready and wash my hands, and I will be straight back. Is that okay?
That's fine.
So I'm going to leave you with your call bell in case you need anything whilst I'm gone. I'm going to be straight back. I'm going to pull your curtains to give you some privacy. I'm going to make sure the fan is switched off and the windows are closed. And if there's anything else you need... Oh, Helen, I just forgot to ask you. This is going to take about 10 minutes. Are you comfortable at the moment? Did you need to use the washroom or anything like that before we start?
No, I'm fine. Thank you.
So you're happy to go ahead now?
Yes.
Okay, as I say, I'll go and get the equipment and I'll be right back, okay? So I'm going to wash my hands, making sure to use the elbows, wetting my hands, applying some soap, palm to palm, palm to back, palm to palm, fingers interlace, fingers interlocked, rotation of the thumb, tips of the fingers and the wrists. Then I am going to rinse. Using hand towels from the tips of the fingers down to the wrists. I'm going to make sure my hands are dry. Dispose of the towel in the domestic waste. Making sure that my hands are thoroughly dry. So I'm going to use a tray for my injection. So first of all, I'm going to make sure I clean that. So I'm going to place on an apron. And a pair of clean non-sterile gloves. Taking some 70% alcohol wipes, checking the expiry date. I'm going to clean my kidney dish. For 30 seconds and allow it to dry for 30 seconds. I'm going to dispose of these gloves and apron in the clinical waste. Then I am going to start assembling my equipment. So I am going to need a 23 gauge needle. It's in date and intact. I'm going to need a blunt drawing needle, which is in date and intact. I'm going to need a 2.5mm syringe. I'm going to need 2 alcohol wipes, which are intact and in date. Checking both of the dates. I'm going to need a pack of gauze, which is in date and intact. So, doing my hand hygiene. I am going to get a sharps box, making sure it's not full and it's safe to use. I'm checking my prescription. I've got hydroxycobalamin 1 milligram per mil. I'm checking that with the medication. I've got hydroxycobalamin 1 milligram per mil. Checking the it's got 20 mils in this vial. Checking the expiry date and the batch number. So I've got the right medication. So I'm going to start preparing. So opening the syringe by pulling 2 parts open and not touching. I am going to get my syringe ready. I'm going to take a piece of gauze and a sterile wipe. I'm going to wipe the opening of the vial for 30 seconds and allow it to dry for 30 seconds. Using a piece of gauze, I'm going to snap the opening and dispose of the lid straight away. Taking my syringe with my drawing needle, I am going to draw up 1 ml of the injection. Using a single-handed scoop method, I'm going to make this needle safe whilst I make sure that I've got the right amount and no air bubbles. Okay. So, disposing of that needle straight away, I'm going to get my administering needle ready and put that straight onto there. I will show my examiner that I have 1 ml with no air bubbles.
That's correct.
Now I'm taking my vial with me. I need a piece of gauze. I need my prescription, and I need the sharps box, and I need to go back to my patient. Hi Helen, I'm back.
Hello.
Hi. Are you ready to have this injection?
Yes.
Okay, so I just need to confirm with your wristband again. Can you confirm your date of birth for me?
Yes, it is 6th of June 1950.
Okay, so I can confirm that I have the right patient. I have hydroxycobalamin, 20 mils, 1 milligram per mil. I have the right medication. I've got an IM needle here ready, and I've got 1 mil, so I can confirm that I've got the right dose and the right route. And it's prescribed for now, so we've got the right time. Okay, Helen, you said that you wanted this in the top of your arm, is that right?
Yes.
Okay, so measuring the landmark for where I am going to do it, I'm going to place 3 fingers on the acromion process and making a V, and this is where I'm going to inject it, okay? So I just need to have a quick peek at your skin to make sure there's no sores or anything, or any inflammation or anything here before I start. Is that okay?
Okay.
Lovely. So yeah, this is fine to do this here, okay? So this is my 3 fingers and the landmark. This is where I'm going to be giving the injection here. So I'm going to just clean your skin with an alcohol wipe, Helen, okay? So in a small circle going out to 2 centimetres, okay? So placing a piece of gauze between my fingers. Helen, you said you had an injection before, but a long time ago, is that right?
Yes.
Okay, so what I'd like you to do is take a deep breath in for me and slowly breathe out when I say. Is that okay?
Okay.
Okay, so I'm going to stretch the skin with my non-dominant hand, and with my dominant hand I'm going to inject. So deep breath in for me, and here we go. Slowly breathe out. Lovely, nice and slowly. So I'm making sure that the needle goes at a 90-degree angle, like a dart, with approximately 1 centimetre remaining out of the skin. I'm going to pull back, aspirate, make sure that I'm not in a blood vessel, there's no blood in the syringe. So I'm slowly going to inject this at a rate of 1 mil in 10 seconds. So nice and slowly. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. I'm going to leave the syringe there for another 10 seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Then placing the gauze, I'm going to remove the needle swiftly and secure it with the safety catch and dispose immediately into my sharps bin. I'm going to put some pressure here, but I'm not going to rub the area at all. How was that, Helen?
Yeah, that was not too bad.
Okay, it's all done. You can relax now, it's over.
Good.
Okay, so there's no bleeding, so you don't need a tissue or anything here, okay?
Okay.
So that's all done. Helen, it's a supplement, so it's unusual to get any side effects from it, but or any adverse reactions, but like with any medications, there's always a chance. Okay, so if you start feeling flushed or warm, or you have any itching, or if your tongue, or you feel any swelling in your mouth or anything like that, please use your call bell and let us know. Is that okay?
Okay.
Okay, so I'm going to take this equipment away and get rid of it. Are you comfortable right now?
Yes.
Okay, are you sure? Do you want a drink or anything?
No, I'm fine.
Okay, but you have got your call bell there if you need anything, and I'm going to make sure I sign this for the time and date now. Make sure that I document the batch number and the site that I've given the injection, all on this nursing notes before I leave. Thank you, Helen. Hi, Helen, I'm back.
Hello.
So are you ready to have your injection?
Yes.
Okay. So, as I explained earlier, the best place to have it is in your tummy. Are you okay with that?
Okay.
Okay. So, can I just confirm, can you just tell me your name again, please?
It's Helen Gray.
And your date of birth?
It's 6th of June 1950.
Okay, and your hospital number I can see here is F001001HC. And you're only allergic to penicillin, is that right?
Yes.
Okay. So, I can confirm that I've got the right patient. I've got here dalteparin, 5,000 units in 1 ml, 20 mils. So I've got the right drug. I've got subcut and I've got 1 ml. So I've got the right route and the right dose, and it is prescribed for now. So I've got the right time. Okay then, Helen. So I'm just going to expose you, pull the curtains and provide privacy for you, and expose your tummy a little bit, okay? So I've checked your tummy, and I'm happy that it's a suitable place there to give. So taking my syringe, I am going to pinch. And if I can pinch more than 2 inches, I'm going to give the injection at a 90-degree angle, and if I can't, at a 45-degree angle. For subcut injection, I'm not going to clean the skin surface unless the patient is immunocompromised, which Helen isn't. So, Helen, okay, I've pinched in 2 inches here, so I'm going to administer this injection at 90 degrees, okay? So, sharp scratch, nice and slowly in. No need to aspirate, and slowly administer the medication. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Swiftly remove, seal the safety cap and dispose promptly into the sharps bin. Put some pressure, do not rub, and release the skin. All done, Helen.
Oh.
You're very brave. All done. Okay. So, taking off my gloves, I'm going to do my hand hygiene. And make sure you're covered and dressed. Okay, are you comfortable, Helen?
Yes.
Okay, so I'm going to take the prescription and I'm going to sign the time, the date, and make sure it's signed and that I've given the medication. So you'll do another one of those tomorrow at the same time, Helen.
Okay.
Okay, so try not to rub that area because it will cause a bit of bruising if you do that, okay?
Okay.
Don't be tempted if you can avoid it. So here is your call bell. You have a glass of water. Is there anything else I can do for you before I go?
No, I'm fine, thank you.
Okay, so I'm going to open the curtains and let you see the rest of the ward and dispose of my items accordingly and wash my hands in the basin. Okay, I'll be around if you need anything, Helen.
Okay.